It is National Nurses Week and National Stroke Awareness Month, and today we are learning how to identify and prevent strokes. With us this morning is Jason Gleason, a nurse practitioner with the Veterans Health Administration. Jason, thank you so much for being with us. So first question for you this morning, what is a stroke and how can someone identify the signs of it?
Good morning. I'm thrilled to be with you today. You know, May is an interesting month. It's National Stroke Awareness Month, and also it's National Nurses Month. So a good shout out to all the nurses out there. For myself and my professional organization, the American Association of Nurse Practitioners. You know, back to your question, stroke is such an important topic. It kills so many Americans, and 800,000 Americans have a stroke every single year in our country. So what are the signs? What are the signs of stroke? If you remember, be fast. It's very easy to remember. Be fast. Balance issues or dizziness, eye issues or eye movement issues. If you have any facial numbness or drooping, if you have any arm weakness or leg weakness or speech changes or slurred speech, the T in be fast, if you have any of those symptoms, stands for time. So it's really important to call 911 if you notice anyone having any of those symptoms.
All right, very important signs and symptoms to keep in mind there. What are also the biggest factors that increase the risk of a stroke as well?
You know, that's such a great question. You know, 80% of all stroke is preventable. So there's a lot we can do about this to prevent it from even happening. So the three top risk factors that I think of are tobacco use, so smoking tobacco use, that's one. Diabetes is another one, and hypertension or high blood pressure. And 50% of all Americans have high blood pressure. Some of us don't even know it. So reaching out to your healthcare provider to reduce your risk. There are many tools that we can offer you to help you in that journey, because it's not easy to quit smoking or improve your blood pressure or control your diabetes. But nurse practitioners like myself and those across the country, we're here to help our patients, and just reach out to us.
And oftentimes you hear of strokes being sometimes a silent killer. Are there signs or anything for people within a certain age that they should also look for? I know you mentioned some of them earlier, be fast, but is there anything that people should keep in mind for a certain age group?
You know, I know firsthand, about stroke. As a provider, I take care of patients that have had a stroke, but I also know the devastation of stroke personally. My wife passed away in 2011 from a stroke, and she was 40 years old and in great health, so it can strike any of us. And I've learned that personally myself, and our three boys did. They were 7, 10, and 14 at the time. It was devastating. It shattered our life. But in some cases, you don't know when it's going to strike, so the importance is to activate EMS right away and get patients to the hospital as soon as they can.
All right, Jason, I'm sorry to hear about your wife, but I'm glad to see what you're doing. You're kind of using her life and her legacy and making some good out of it as well. And thank you. I know it's early in Montana, so we appreciate you waking up with us as well this morning, too. Thank you.